Hi, everybody. This is Ariana Anderson here. I'm from Anderson Family Chiropractic and Naturopathic Care. I'm a traditional naturopath here in our clinic, and we're going to talk a little bit about how to improve sleep naturally. It's a really big deal, and I think probably, I don't know, maybe 60 to 70% of people that come in here have issues with sleep. So we're going to talk a little bit more about that today. All right, give me a minute. I'm going to share my screen with you. All right. All right, we'll make me a little bigger over here. Hello. All right, so we're going to talk about improving sleep today. So William Dement, medical doctor, PhD, director and founder of the Stanford University Sleep Disorders Clinic and Research Center, has been quoted as saying, "You're not healthy unless your sleep is healthy." Absolutely true. It's really hard to reestablish wellness and health without having decent sleep patterns. And we're going to talk about that a little bit more in this video. So some of you may or may not have heard of what's called the circadian clock, but our bodies have a rhythm, just like we have, we have a moon that goes around the earth and we go around the sun, and we see all the rhythms that happen in nature. We have our own rhythm too within our body, and we refer to that as the circadian clock. And, it regulates your sleep, your feeding patterns, your ability to be alert, your core body temp, brainwave activity, hormone production, regulation of glucose and insulin levels, urine production, cell regeneration, and many, many, many other biological functions. So yes, it absolutely is important that we get good sleep. So hormones actually are very affected by circadian clock. And the ones that are affected by sleep are melatonin. Some of you probably have heard that. So a lot of times people will take melatonin to get to sleep. It's basically a kind of a hormone replacement type of a therapy. But your pineal gland is the gland that produces melatonin for you. And melatonin, what it does is it will cause drowsiness and will lower your body temperature. Cortisol, which you've probably heard about that. That's your stress hormone, right? Adrenal gland hormone manages stress responses. It stimulates glucose and blood sugar release. So pretty big and important hormone. Growth hormone, that it helps to repair and restore processes of the body. It is secreted during sleep, particularly during non-REM sleep. So it's really important that we get good sleep for growth hormone. As we age, we make less of it. You never notice that the young folk, they seem to heal and regenerate a lot quicker than, as you get a little older, a little more seasoned, if you will. And that's because one of the things is that we start to make a little less growth hormone. So another reason why getting good solid sleep is essential, so that we can, optimize that. And obviously testosterone too, which is male hormone. These hormone effects appear to be regulated by actual sleep and not necessarily just by circadian rhythm. So we really actually do need to sleep. So let's just talk a little bit about melatonin and cortisol. So you can see here, starting at like 6 in the morning and then all the way to 9 the next morning. You'll see in the morning, this right here is melatonin, the red line, and then the black line is cortisol. As we're reaching the time in which we're supposed to be getting up and ready to go, our cortisol levels should be higher. This wakes us up. It's like, woo-hoo-hoo, we got to get stuff done, right? And then at that point, your melatonin levels should be very low. And then throughout the day, the cortisol levels will go down so that we can start getting a little more relaxed. And then around the time when it's starting to get dark, we're going to start to see some melatonin increase. And that it should be highest in the middle of the night, so that we're having some deep sleep. Part of the issue that we have is that these hormone levels are out of balance. And we're going to go into that a little bit more in these next slides. So this is these, obviously there's no names on this, but these are actual people. These on the top here. This is what this is showing you, is we're talking about cortisol on these slides. So This is actually a relatively normal one. So you can see in the gray, these are normal levels where in the morning cortisol is elevated, and then at night this is where it should be. So this wakes you up, and then it's going to be lower here so that you can get sleepy. But this is more often what happens is these other things. So you can see here, this person is probably pretty groggy, but can get going. They have a little bit of a pick-me-up at noon, but then a big dip in between like 2 to 4 p.m. That's pretty normal. And then whoo, look at that. Cortisol is flying at night. And so you think they're going to get much sleep? Probably not. And then you can see this poor person is tired probably all day, all night, poor thing. Just having a real hard time. And then this right here, you can see that they're kind of in normal ranges. And then we see this cortisol boost right here. Could be from, jolts and caffeine, things like that might have been elevating that. And then of course it's coming down. And then this poor person, of course, they're dogging it all day. So you can see that oftentimes when we have those hormones tested, these ones were tested specifically with saliva, which I would recommend if you're testing hormones that you do saliva tests versus blood tests, because it helps to see what's in the tissue and not just in the bloodstream. You can see that, we have some disruption. Honestly, most of the time, people are looking more like this, or, I've seen this too, where we see a big spike at night and they can't sleep and they're just, they're up all night. All right. So now obstructive sleep apnea, that is a concern for many, many, many people. The CPAP machines people have to help them breathe while they're sleeping so that they don't, there isn't obstruction to the breathing. But sleep apnea causes poor sleep quality due to uncontrollable pauses in breathing, usually between 10 to 60 seconds, but they'll have that a dozen or so times per night. So you can imagine if your body is not getting oxygen to the brain that many times during the sleep cycle, it absolutely will cause problems with deep sleep. They will have shallow breathing during sleep, and then oftentimes will suddenly wake up startled if their breathing is paused for a really long period of time. So sleep apnea generally, it essentially causes less oxygen to the brain and elsewhere in the body, and it disrupts detoxification and regeneration pathways from functioning properly during the sleep cycle. So here are some of the symptoms: snoring loudly with pauses in breathing and sound, feeling of being always tired or drowsy even after getting a full night's sleep, waking up suddenly or abruptly and feeling startled by a loss of breath, shortness of breath when waking up, night sweating and frequent urination, waking up with a dry mouth, sore throat or bad breath, headaches, struggling with other sleep problems, including having trouble falling or staying asleep, sometimes called insomnia, experiencing trouble concentrating, poor memory, brain fog during the daytime, becoming more irritable, anxious, and depressed than usual due to a lack of sleep, having lower immune function and higher risk for other disorders as a side effect of hormone imbalances. So those are just some of the symptoms and warning signs that perhaps this is an issue. And so here's some of the stats. According to the National Sleep Foundation, anywhere from 2 to 9%, depending on the demographic of Americans, are suffering from sleep apnea. That's anywhere from 5 to 22 million. Men are twice as likely to have sleep apnea than women. Obesity has been found to have 4 times the risk of developing sleep apnea, and we'll talk a little bit more about why that is on the next slides. It is estimated that 4 out of every 100 middle-aged males and 2 out of every 100 middle-aged women. About 2% of children have obstructive sleep apnea, which causes noticeable symptoms. Interestingly enough, a Yale University study did see that sleep apnea doubles your risk for having a stroke and increases risk of high blood pressure, risk for blood clots, and other cardiovascular diseases. So as you can see, that this is a big deal, and it definitely needs to be attended to if it is an issue. But there are natural ways that you can support this. Now, according to the National Institute of Health, sleep apnea is actually the leading cause of excessive daytime drowsiness in adults. This is an interesting slide. This was published in the Lancet in 2016, and it's just interesting to show how sleep apnea can be a contributor or at least an indicator of some of these other issues that people face, including stroke and congestive heart failure. You see that in 63% of cases with stroke, sleep apnea is present. And now half of the cases of congestive heart failure, it is present. So it definitely is a risk factor that we need to attend to. Now this is just kind of an interesting side note. So this was published in the American Academy of Sleep Medicine in 2016. And I just thought it was interesting. We don't really think about this, but these are some of the hidden health costs to sleep apnea. So it contributes to about $6.5 billion worth of workplace accidents, about $86.9 billion in lost productivity, about $30 billion in comorbid diseases, and $26.2 billion in contributing to motor vehicle accidents. So you can see it's pretty costly, and it decreases a lot of our efficiency in the workplace, just this inability to sleep right. So this shows you a little bit about what's happening with this. So essentially, inflammation, loss of tone, and crowding of throat muscles is the issue. So this would be normal breathing, and so you can see where this is your uvula. And then this is where the air is coming in through the sinus there, and then down in through into the lungs. And it should just go right in. However, when we start to see partial obstruction of the airway, you can see right here, there's just some of this is starting to lose tone, right? And it's starting to come into the airway. So when the air comes in through the mouth and through the nose, it sort of vibrates right here. And then that's where you're starting to get the snoring. But when there's complete obstruction of the airway, you'll see that this part is coming down that soft palate and actually obstructing the airway. And so you can see that it can't fully get through, and then that can be anywhere from 10 to 60 seconds. If it goes too long, you're going to wake up. So that's what's actually happening. So let's, when we think about like natural treatments, honestly, a big thing, a huge thing is weight loss. So when you gain weight everywhere, including in the throat. And it's interesting, where you have fatty tissue, like say it's around organs and glands, that actually causes inflammation of those organs and glands when it has that excess fat that's not really supposed to be there. And so it can, over time, cause a decrease in tone of those tissues. And so one of the things, if you have a neck circumference as a male greater than 17 inches or a female over 15 inches, it could mean that there is excess fat deposits there. And you'll see that there is a bit of a pattern. So the more obese an individual, the more fat deposit in that upper airway lumen. They will have reduced tracheal traction. They're going to start to have an oval upper airway shape, and then that fat deposit is in the upper airway muscle. And so we're going to have more sleep apnea, leading to reduced physical activity, insulin resistance, and then what they found is that you can start to have increased ghrelin levels. That's a hormone that increases appetite. So of course then we start eating a little bit more and we start having more obesity, and then this is just sort of a cycle that continues on. So there really is a huge advantage to finding ways to lose those pounds and find ways to support your body with a whole food nutritional strategy, so that it will naturally start to lose weight. And also adding exercise, obviously, in there. Movement is incredibly important to that process. So again, some natural treatments or strategies. Proper food combining. So anytime you feed the pie hole, really, you should try to avoid pie. That's step number one. But we try to make it kind of simple. There's a lot of different people, different body types. And so everybody's a little different, but for the most part, every time you eat, you should have some type of a healthy protein, some type of a healthy fat, and then a vegetable. A vegetable. That's right. I know. Every time you eat, you really should have a vegetable. I know that's super hard. I think it was Dr. Mark Hyman, who is the director of functional medicine at Cleveland Clinic. I think I had read in one of his books that he recommends people getting 7 to 10 vegetables a day in their diet, like because the nutrients in our food has gone down so significantly. We need that much more vegetables for the phytonutrients to run our body. So should we just immediately start at 5 to 10? No, we just want to try to be strategic to put a vegetable in every meal. And I know we want to substitute fruit because fruit is sweet, but think about it, folks. Fruit is sweet. So it increases sugar, which is, of course, part of the problem. So you can have fruit, just don't have more than like 2 pieces of fruit, because most people can't have more than, they won't eat more than 4 vegetables a day, because I'm always pretty excited if they can. And you really want to have twice as many vegetables as fruit. So definitely every time you eat, healthy protein, healthy fat, and a vegetable. You can have other things with it, but you want to have those 3 things every time, because it helps to support proper blood sugar levels. You want to avoid inflammatory foods and substances. So some of the big ones is sugar and starch. If it elevates blood sugar, it can be very inflammatory. A little bit, like with fruit, is fine, but when we're eating a lot of bread and pasta and other types of things that have a lot of starch in them, we don't think of that as sugar. But ultimately, if it's like, say, white rice or wheat, those things will break down into sugar very quickly in the bloodstream, elevating blood sugar. So those things we really want to limit. Alcohol. So this is an interesting thing. A lot of times people will drink alcohol or take sedatives before bed, thinking, oh, well, this will help me sleep well. Well, if the issue is sleep apnea, this is going to be, it's going to be to your detriment, because what happens is it relaxes those throat muscles more. And so remember how that lumen was being obstructed because those throat muscles were losing tone. Well, so when you're more sedate, those muscles actually relax more, and actually the symptoms can increase. So you want to avoid alcohol and sedatives within 3 hours before bed. Smoking, they have found, unfortunately, for those that like to smoke, you are 3 times more likely to have sleep apnea. And just keep in mind, it's not good for you. So that would be a good one to just get rid of if you think that you have sleep apnea. Find some way to at least reduce it if you can't eliminate it. And again, I had mentioned sedatives. Regular exercise, it improves muscle mass and tone. It improves the cardiovascular system, and it stimulates lymphatic drainage. All 3 of those things are very helpful in helping to support this particular issue. There's some other things you can do from herbal and essential oil therapy. Just a real quick one, cinnamon and ginger combination does help reduce appetite in some cases, and it helps support the body's natural ability to balance hormones and digestion. And that's just kind of a yummy natural thing that you can bring in. But there's other things too. That just was a quick one that most people kind of enjoy. Other natural treatments. So acid reflux can be a contributing factor to sleep apnea. So if you have acid reflux, congestion, or coughs, it's going to increase irritation and swelling in that area, right? So with acid reflux, sometimes it makes its way up into the esophagus, into the throat and voice box. Really what you want to address here is an underlying stomach imbalance. The root issue is actually not enough hydrochloric acid in the stomach. I truly mean that it's not that there's too much, it's that there's not enough, it's not getting acid enough, and it's not signaling hormones to open up the pyloric sphincter for the food contents to move into the intestinal tract. If you want more information on that, go back into my YouTube channel, our YouTube channel, and look for the lecture I did on digestion. I go into that specifically to explain why that is. I know it seems like that's backwards, right? Because we feel acid, but really, truly, the issue is that there's not enough acid. And acids actually compound the problem. They will help you feel better in the short term, but they will make the problem worse in the long term. So if you really are interested in that, go back and look at that lecture, and it explains it in detail. Also avoid acidic foods until the imbalance is corrected, such as coffee, tomatoes, etc. Those just will give you a lot of grief until it's essentially a little sphincter that is in between the stomach and the esophagus. Until that sphincter gains some tone and closes up, you know, anytime you're eating things that have a more acidic in nature, but aren't acid enough, such as like betaine hydrochloride, sometimes those can make their way up into the esophagus and give you grief. But I've definitely seen that over time, as the tone of that sphincter between the stomach and the esophagus gains tone, that people can bring those things back in their diet. Congestion and coughs addresses underlying immune challenges and drainage issues. So you know, there's nutrition, herbs, and exercise. I can definitely assist the folks that come here with this, with the technique that I use to help you get a designed clinical nutrition program to support that. Another thing you can do, which is easy, most people have a humidifier or a diffuser. You can put immune support. That is a blend that we have here in our office. It smells amazing, and it's really great to help with lymphatic drainage. Or an essential blend called Cool Pipes. That one has some eucalyptus in it, smells a little bit like Vicks, but I think smells better than Vicks, but it's a natural form of that. And we also have that in a salve that you can put on your chest. So it smells similar. I think it smells a little better because there's some lavender in it. And you can use it either in a diffuser, or you can put it on your chest at night. So more natural treatments, a lot of people try this first, is adjusting your sleeping position, elevating your head while you're sleeping. Sometimes people have like a wedge that they sleep on. Avoid sleeping on your back. That actually presses the tongue and palate tissue against the back of the throat. And so a lot of times people can be propped on one side or the other, but make sure that your back is being supported, and put a pillow between your legs so that those hips are being supported as well. You can get snore guards and sleep devices for temporary symptom relief. These are things that if you've tried everything and you're still having no luck, these are just options that are out there. You can talk with your your dentist about their recommendations, but snore guards will fit in the mouth. They help bring the lower jaw forward and open the airway. You can get mandibular advancement devices that are inserted by a dentist, and then nasal masks for individuals that breathe through their nose while sleeping. So, okay, if we have sleep disorders, sorry. The more often and severe the symptoms, the more stress on the organs, using up more vitamins and minerals. Okay, and that's going to lead to some nutritional deficiency, right? And then if we have a little bit of nutritional deficiency, then we're going to have vitamins and minerals and fuel that need to fuel our organs that are going to be lower, which is going to lead to a little bit of organ dysfunction. Now, if our organs are not working 100%, even if it's just 90%, it's going to decrease the ability to absorb, digest, and utilize vitamins and minerals, which is going to lead to more sleep disorders, right? More often again, then the severe the symptoms, the more nutritional deficiency. And so you can see that this can go on and on over time, kind of a vicious cycle, where we could even get down to like 30%, right? So usually when we start to see these things, the sleep disorders or other disorders that happen, it's not because it just happened. It's that it's been going over years and years and years. And so it's going to take a little bit of time to recover. So how do we help? With every symptom imbalance, there is a nutritional deficiency and an organ dysfunction. So what I do in our office, how I assist, is halting that vicious cycle to prevent further damage and support and enable the body's ability to stabilize and improve. So how do I do this? The thing I do is find out what specific vitamin and mineral that you have, deficiency that you may have, and then find exactly what organs are already being affected and fix and handle them once and for all. Now, we do have a sugar quiz if you're ever interested. You can certainly give us a call. We'll send it to you. One of the biggest things, honestly, is sugar in the diet. We really need to decrease that. But we can definitely help with design clinical nutrition programs that can help support your unique body. So next steps, you can check out our nutrition response testing link in the description. That will give you a little video of my main modality, which is nutrition response testing, which is just a form of applied kinesiology. And for more information on how that works and if it would be a good fit for you, and then you can call or email our office for a consultation. The number is 419-878-8312, or our email is afcwellness@hotmail.com. And thanks for stopping out. We love all of you wellness warriors trying to increase your overall health and wellness. So if you ever need anything, please don't hesitate to give us a call. If you're out here in Waterville, Ohio, we'd love to talk to you. Thanks. Have a great day.